Welcome everybody to a day in my dental hygiene life. Disclaimer, every practice works differently, but this is how my primarily dental hygiene days go, so I hope you enjoy. So it's about 7:40 now, and if I've got time I'll make a hot beverage. I'm lucky at this practice as we have a hygiene coordinator, so I don't have to set up my surgery in the morning. Now I'm on my way to the morning huddle. This typically goes for about 10 minutes. It's where the whole team discusses the day to ensure it will run as smooth as possible. It's a really important part of the day to make sure everyone is on the same page. After the morning huddle, I then head down to my surgery to check my appointment book for the day. I review all patients, and usually there are already appointment codes that indicate which patients require perio charts or x-rays, which the lovely ladies at reception do. They're the best. And if I have any new patients or perio patients, they're all color coded as well. X-ray holders will also be at the bench ready to go to be super efficient if the patient needs them as well. My first patient of the day is usually 8 AM. I do like to bring in my own patients. I find that it's more personal. My routine hygiene appointments are 60 minutes. In this time, I will update any records, clean the patient's teeth, provide oral hygiene instruction, and the dentist comes through for an exam too. This chat is the most important as you're able to build rapport, check medical history and note any changes and find out what the patient's concerns are. It's also a great time to chat about the patient's oral hygiene routine. As you can see here, we have all the greatest products for low to high caries risk patients, and if they've been prescribed any of these previously, to touch base about their use. I will also demonstrate to patients what they need to use, how to use them, and identify which interdental aids will work best for them. The patient usually has a pre-procedural mouthwash before I sit them back here, but typically at this point of the appointment, our hygiene coordinator will be with me for the first 10 minutes. I'm looking for my loops here, but I realise they're in another surgery, so I really apologise for the lackluster PPE. The hygiene coordinator at this time is helping with x-rays and processing them, making notes in the patient file for me, and writing down details from what I can see on what we call a ROF, which is a report of findings. A ROF can contain anything from decay we've seen in the mouth or x-rays, patient concerns, gum health status, the patient's attitude, and more. Once this is done, the hygiene coordinator will drop the ROF off in the dentist surgery, and I will then clean the patient's teeth. When I'm finished cleaning the patient's teeth, I will then use a bit more time going over any products I've recommended and answer any questions. Every patient leaves with a goodie bag, usually a soft bristle toothbrush, sample toothpaste, sample floss, and samples of any other interdental aids I recommend for them. I always walk my patient out of the surgery to reception to do a handover. I always book their next appointment with me as well. At the handover, I let reception know when I've booked the appointment with me and let them know if there is any treatment that needs to be booked in with the dentist to ensure the patient has a seamless experience to the end of their appointment. If I'm running ahead of schedule, I will bring my tray of dirty instruments out to Steri. It makes my DA's job so much easier, and it means you get a quicker changeover because they don't have to leave the room after coming in with a clean tray of instruments. I will usually strip the chair and wipe the chair also if I've got the time, so all my DA needs to do is set up with new instruments, gauze, prophy paste, floss and pre-procedural mouth rinse. I also aim to complete my treatment notes before the next patient, as the experience is fresh in my head, which means I'm less likely to omit important details as the day goes on. And then I repeat this about 8 or 9 more times. So that is a typical day in my life as a dental hygienist / oral health therapist. Thank you for watching. If you liked this video, please like and subscribe. I would really appreciate it. I will see you soon.